Hi my dear students, I'm Dr. Jeetu. Hope you all are good. Today we'll deal with periodontal instrumentation. It is a simple and easy chapter. I have referred Karansa edition. There are some additional points in this chapter. So moving into the presentation. When talking about the instruments, there is a simple classification which classifies the instruments into 5 classes. One is periodontal probes. Probes are used to locate, measure and mark pockets. Probes are not just to probe, it is to locate a pocket, to measure as well as to mark a pocket. This will determine the course of the pocket on individual tooth surface also. Then we have explorers. Explorers are to detect calculus and caries. So let's not get confused. Probes are to find, measure and mark the pockets, but explorers are to find roughness on tooth surface. It can be calculus, it can be caries. Clear with that? Then we have scaling, root planing and curettage instrument. It is to remove biofilm and calculus from the crown and the root surface, and it also removes altered cementum from the subgingival root surfaces. And when we used to do curettage, it was used to remove the soft tissue lining of the pocket. The fourth class is periodontal endoscopes. It is for deep visualization into subgingival pockets and furcations which are not visible with our naked eye. And we have cleansing and polishing instruments. These can be rubber cups, brushes, dental tapes, etc., which cleans and polishes the tooth surface. When it comes to periodontal instruments, which is the material commonly used to manufacture instruments, it is stainless steel. The first instrument we are seeing is sickle scaler. They are heavy instruments used to remove supragingival calculus. It is only for supragingival calculus. Then we have curettes, which are finer instruments. They are used for subgingival scaling, root planing and removing the soft tissue lining of the pocket. Then we have hoes, chisels and file scalers. They are also used to remove calculus. But what type of calculus? Tenacious subgingival calculus and altered cementum. Mind, it is for subgingival calculus and it is for tenacious calculus, hoes, chisels and files. Then we have implant instruments, which are plastic coated or titanium coated scalers and curettes. It is for use on implant and implant restorations. Whether it be any instrument, the parts of a typical periodontal instruments are blade, shank and handle. And this handle and shank is the same for any instrument, and if the instrument is a sharp instrument, we call it as a blade. Otherwise we call it a working end. It is not necessarily a blade, and the end of the blade is there. It is called by different names. In a sickle scaler it is called tip, but in a curette it is not pointed, so it is called a toe. In case of a probe, it is known as a nib because it looks like the nib of a pen. It looks like a nib of the pen, so end of the probe is known as nib. First instrument we will be dealing with will be a probe. Probes, there are 5 generations. First generation is the manual or the conventional probe, which we use regularly in our clinics to mark, locate and to measure the pocket. The right side hand, there are figures A, B, C, D, E. All these are first generation probes. One is Marquis color coded probe. 2 or B is UNC 15 probe, markings 5, 10, 15. Then C is University of Michigan O probe with Williams markings. We all are familiar with the Williams markings. The markings 4 and 6 are missing in order to highlight the 5 marking. Then D is there. It is also University of Michigan O probe, but it has different markings. It has markings at 3, 6 and 8 millimeters. And finally E is the WHO probe. We know WHO probe has markings at 3.5, 5.5, 8.5 and 11.5, and it has a bolt tip 0.5 millimeters in diameter. So these are the first generation probes. Second generation probes are modified from the first generation in that they are pressure sensitive. So depending upon the pressure that the operator is giving, the first generation probes can give a different pressure, but second generation probes quantifies this pressure that we can apply to a pocket. Example is Toronto probe. Third generation probes are even more advanced. They are computerized probes. So we get a computerized measurement. Examples are Foster Miller probe and Florida probe. Fourth generation probes are 3D probes. They give us a 3-dimensional image of the pocket. And fifth generation probes are true non-invasive probes. They really don't go inside the pocket. They emit some ultrasonic waves which goes inside the pocket and detects the parameters of the pocket. So these are the generations 1, 2, 3, 4, 5. 1 is manual, 2 is pressure sensitive, 3 is computerized, 4 is 3D, and 5 is ultrasonic. After probe, we will see about the sickle scaler. Sickle scaler has a flat surface. It has 2 cutting edges, and this will converge into a sharply pointed tip. We are all familiar with the sickle scaler. An important question is, what is the cross section of a sickle scaler? It is triangular. You can see from the figure. Next is curette. Curette, unlike sickle, do not have any sharp points or corners. Only the cutting edge of the blade may be sharp. The cross section will be semicircular, as you can imagine from the figure. Then the curettes can be of 2 types. It can be universal, it can be area specific. Universal means their cutting edges can be universally inserted in most part of the dentition. But area specific are specific for particular tooth and particular areas of each tooth. Example for area specific curette is Gracie curette. So as I said, Gracie curettes are area specific, and each number of Gracie curette is meant for a particular area of a particular tooth. So Gracie curettes 1, 2 and 3, 4. So these type of Gracie are double-ended instruments, and Gracie 1, 2 means one end is number 1 and the other end is number 2. So Gracie curettes 1, 2 dead, and Gracie curette 3, 4 are used for anterior teeth. 1, 2, 3, 4 for anterior teeth. Gracie 5, 6 is for anterior as well as premolar. So if you have a 5, 6 curette, you can use it on anterior teeth as well as premolars. Then Gracie 7, 8 and 9, 10 are used for posterior teeth, facial and lingual surfaces. So 7, 8 and 9, 10 are for posterior teeth, facial, and posterior teeth, lingual. Gracie 11, 12 is for posterior teeth, mesial surface. 13, 14 is for posterior teeth, distal surface. This is the classic set. 1, 2, 3, 4 for anterior, 5, 6 for anterior and premolar, 7, 8, 9, 10 for facial and lingual of posterior, 11, 12 for mesial of posterior, 13, 14 for distal of posteriors. Now 15, 16 and 17, 18 are modifications. 15, 16 blade is a combination of blade of 11, 12 and shank of 13, 14. So 15, 16 is 11, 12 plus 13, 14. Blade of 11, 12 plus shank of 13, 14. 17, 18 uses blade of 13, 14, and what shank it uses? It uses a terminal shank that is elongated by 3 mm, and the blade of 13, 14 only, it will be 1 mm shorter, so that we can insert it into relatively non-accessible areas, and it is also more accentuatedly angulated. Now let's see what are the main differences between a Gracie curette and a universal curette. This is very important. They've been asked in exams. So area of use, it is clear from the name. Area specific means it is designed for specific areas and specific surfaces, but universal means it is for all surface and all tooth of the dentition. Cutting edge. For a Gracie curette, only one cutting edge is used, and which cutting edge? It is the outer cutting edge, and so only it is very specific. Only one cutting edge, only the outer cutting edge can be used. But in a universal curette, both the cutting edges can be used. We can work either with the inner edge or with the outer edge, and so this makes it universal. For some tooth, we can use the inner cutting edge, and for some other tooth, you can use the outer edge and you can curette. What about the curvature? For Gracie curette, there are 2 curvatures. It curves from the shank to toe as well as from side to side. These 2 curvatures are present for a area specific Gracie. But for a universal one, there is no side to side curvature. There is only the shank to toe curvature is present. Then blade angle is also a very important parameter. For the Gracie curette, we call the angle as an offset blade. A blade that is beveled at 60 degrees to the shank is known as the offset blade. In some areas you can see 60 to 70 degree angulation. But for universal curette, the blade is not offset. The blade is at 90 degrees to the shank. So for Gracie it is offset blade, it is 60 degree. For universal it is not offset, it is 90 degrees to the shank. There are 2 types of shank designs, rigid and flexible. Rigid shank is used to remove moderate to heavy calculus. So when we are engaging the curette onto moderate or heavy calculus, the shank has to be rigid. But flexible shank, where do we use? We are not able to use it in a heavy calculus area. It is after scaling, we can use it for our tactile sensitivity to see whether the scaling is complete, and it can also be used for root planing. Another important question is extended shank curettes. So from the term only it is clear the shank is extended. By how much? It is extended by 3 millimeters. One example of extended shank curette is after 5 curettes. So what is the modification in after 5 curettes? Again, it's an extended shank curette, but we call them after 5 because they can go into pockets deeper than 5 millimeters. So they are known as after 5 curettes. Extended shank curettes, example after 5 curettes, are a modification of the standard Gracie where terminal shank is extended by 3 mm. In extended shank curette, Gracie 910 is not available because 910 has a complex shank design. They couldn't modify this and extend it by 3 millimeters. So one important question is 910 is not available in the after 5 series. So what is after 5? Now there is another curette known as mini 5. Here you should look into the figure also. So the first one is a standard Gracie. When it was extended by 3 mm, we called it after 5. Now mini 5 is a modification of after 5 where the blade length is halved. So when the blade length is smaller, when we insert that into the pocket, there is a reduced tissue distension and lesser tissue trauma. So now we know what is after 5, what is mini 5. Next is micro mini 5. Micro mini 5 is smaller than mini 5. The blades are again 20% thinner and smaller than the mini 5. So someone asks you what is the modification of micro mini 5 from the standard Gracie. It is extended shank by 3 millimeters. Then blade length is 20% thinner and smaller than the mini 5, which is 50% half or 50% or half than the standard Gracie. Now let's see what a curvette is. It is not curette, it is curvette. Gracie curvettes are a set of 4 mini bladed curettes. The instruments are as follows: sub-0 and 1, 2, 11, 12, 13, 14. That's all. It's a set of 4 curettes. Sub-0 and 1, 2 are used for anteriors and premolars. So anterior till premolar is over. Now what is remaining? Molars. 11, 12 is used for the posterior teeth mesial surface. 13, 14 is used for the posterior teeth distal surface. So what is the modification here? Just like the mini 5 curette, the blade length is 50% shorter than the conventional Gracie. And why we are calling it a curvette? Because its blade is slightly curved upwards. You can see that in the figure. One more important feature is you can see markings. You can see 5 mm and 10 mm markings in the curvette. So that we know till where we are curetting, till where we are instrumenting. This is a new edition in the 13th edition Karansa Periodontal Maintenance Gracie Curettes. It was introduced in November 2015. From the name it is clear it is to be used during the maintenance phase of the patient after the completion of the active periodontal therapy. So what are the indications? Tight tissue. After initial treatment, the tissues would have tightened, the tissues would have receded. So recession and residual pocket depths which are remaining after the initial periodontal therapy is to be instrumented using periodontal maintenance Gracie curettes. Here the modification is different. In after 5 curettes we saw it was 3 mm longer shank. Maintenance curettes are having a 2 mm longer shank, and what happens to the blade? Blade is 1 mm shorter and 20% thinner. And blade is at offset of 60 degrees. We already know it is a Gracie curette, so it has an offset angle of 60 degrees. You can see the figure. The periodontal maintenance Gracie curettes, there are 4 colors. The grey is there, green is there, yellow is there, and blue is there. It is numbered 1, 2, 7, 8, 11, 12 and 13, 14. After Gracie, we'll see what a Langer curette is. Langer curette is described as the marriage between Gracie and universal curette. This allows the advantage of the area-specific shank and the versatility of the curette blade. We know it is great to have a blade which will adapt to any tooth surface and a shank which is specified for each particular tooth. So here the shank design of the Gracie 5, 6, 11, 12 and 13, 14 curettes are used with the universal blade. So Langer curettes are only 3 in number: 5, 6, 11, 12 and 13, 14. Next is Schwartz Period-Reverse. Look at the figure. Have a look. You may get this as a figure-based question. Schwartz Period-Reverse are set of 2 double-ended, highly magnetized instruments. From the term only it is clear. It is a period-retriever. It is for retrieving something, for retrieving broken tip of the instrument from the periodontal pocket. Now we finished probes, sickles, scalers, curettes. Now we will see what is hose scaler.
Hose scaler is used for scaling of ledges or rings of calculus. It is not for flex of calculus. For ledge or ring of calculus, we will use a hose scaler. What is the specialty of hose scaler? The blade is bent at 99-degree angle. And one more angle you should remember about hose scaler is cutting edge is beveled at 45 degrees angle. So blade is bent at 99 degree and cutting edge has a bevel of 45 degrees. One more important point about hose scaler, it maintains 2-point contact on a convex tooth surface. Example of a hose scaler is McCall's scaler number 3, 4, 5, 6, 7 and 8. It is a set of 6 hose scalers. It can provide access to the entire dentition. Next is file scaler. File means it has a series of blades on a blank or a base. Their primary function is to fracture or crush large tenacious calculus deposits or burnished sheets of calculus. You can imagine a file. When very large calculus deposits are there, if you file upon that, it may get crushed or it may get deposited in pieces. It is used for removing overhanging margins of restorations also, not only for tenacious calculus but also for dental restoration overhanging margins. Example of file scaler is Hirschfeld files. Note this, when we hear the term file, we often tend to remember Sugarman and Schluger files. Sugarman and Schluger are bone files. For removing the calculus, the file scaler which is used is Hirschfeld file. Coming to chisel. Chisel is designed for the proximal surface of the teeth which are too closely spaced so that other scalers are not getting inserted. Usually in the anterior part of the mouth, teeth are very closely spaced. We use chisels here. Chisel should be inserted from the facial surface and the instrument is activated with a push motion. Note that term, push motion. Which instrument is used with a push motion? You should go for chisel. Chisel scaler is used with what motion? Push motion. This has been repeatedly asked. You would have seen this carpenters working with their chisel. We can see them pushing it forward. It is very nice to observe that. The same thing, the chisels which is used in the oral cavity should also follow a push motion. Next instrument is Quettin furcation curettes. Quettin curettes are actually hose. We had learned some points about hose if you remember. It was having a 99-degree angulation for the blade and the cutting edge was beveled at 45 degrees. It had 2-point contact with the tooth and example was McCall hose. So Quettin curettes are actually hose with a shallow half moon radius that fits into the furcation. So they are furcation curettes actually. They have better access to the furcation. We have 2 types of Quettin furcation curettes, BL for the buccolingual and MD for the mesiodistal. We have BL1 and MD1 which are smaller and finer. They have 0.9 mm blade width. BL2 and MD2 are larger and wider. They are having 1.3 mm of blade width. So that is about Quettin furcation curette. Next is diamond files. Diamond files can also be used on the root surface, but they should be used very carefully because they can cause over instrumentation of the root surface and they should not be used with excessive force. That is about diamond files. Then finally, we already said we have fiber optic endoscopes. Endoscopes are 0.9 mm diameter, meaning to say they're very small, reusable ones, over which a disposable sterile sheath is fitted. And what is the magnification that we get? It is 24 to 48 times, right? After scaling, we often do polishing. So a word about air polishing. Air powdered slurry of bicarbonate, specifically sodium bicarbonate, and warm water is usually used for air polishing. It is used to remove extrinsic stains and soft deposits. Other options are glycine hair powder polishing and erythritol powder. There are 2 contraindications for air powder polishing. One is respiratory illness and 2 is patients on hemodialysis. After having an idea about different instruments, we will see how these instruments should be used. So this includes principles of instrumentation. There are 6 principles. One is accessibility. Just imagine that you are seating a patient and you are going to instrument. First, what do you need? You need accessibility. Then you need visibility, illumination and retraction. You have to see properly what is happening in that particular area. So for that you need visibility, you need lighting, and you have to retract the cheek or tongue, whatever. Then condition and sharpness of the instrument is very important. We have to maintain our instruments in a clean and sterile condition and it should be sharp. Then after that, maintaining a clean field. That field should be maintained properly without any blood, saliva. It should be clean. After that, we will stabilize the instrument in the cavity, oral cavity of the patient, and finally we will activate that instrument. So these are the principles of instrumentation. You will get that by imagining the steps you do after seating a patient before you instrument. We already saw we have to stabilize the instrument properly before we activate the instrument. So there are two components in stabilizing an instrument: grasp and rest. First, what is instrument grasp? The most effective and stable grasp with greatest control is modified pen grasp. So we know there are different ways in which we can hold or grasp an instrument. Out of the pen grasp is there, modified pen grasp is there, palm and thumb grasp is there. Out of this, most effective, most stable and greatest control is provided by modified pen grasp. Where do you use palm and thumb grasp? You use it for sharpening of instruments and also for manipulating the air water syringes. This question is important, it has been asked. After grasp, we will go into rest. Rest means we have to provide a firm fulcrum before we activate the instrument. So there are 4 types of fulcrums. We have to be clear about this because this has been asked multiple times, and this is easy as well as very important. So first is a conventional rest. Conventional rest means the finger rest is established on tooth surface immediately adjacent to the working area. Usually we use a ring finger, and this finger is kept on the adjacent tooth to the working area. Second is cross arch. When we say the word cross arch, you should imagine you should cross the midline. So finger rest is established on a tooth on the other side of the same arch. Okay, so if left side of the maxilla you are working, your rest is in the right side of the maxilla. Opposite arch means finger rest is established on the opposing arch. If you are working on the maxilla, you get rest from the mandibular tooth. And finally, finger on finger means the finger rest is established on index finger or thumb of the non-operating hand. If you are a right-handed operator, you can place your left hand on the patient's face or arch, maxillary or mandibular arch, and you obtain finger rest from the index finger or thumb of this left hand. So these are the figures. First is conventional, rest is on the tooth adjacent to the working area. Opposite arch means opposing arch. You are working on the maxilla, you are getting rest from the mandible. Cross arch means you are crossing the midline. And finger on finger, you are taking rest from the thumb of the non-operating hand, which is resting on the arch of the maxillary arch of the patient. Next is instrument activation. There are 3 aspects in instrument activation: adaptation, angulation, and lateral pressure. We will see what each of these terms means. Adaptation means it is the manner in which the working end of the instrument is placed against the tooth, or how the instrument is adapted to the tooth surface. How it should be: the lower third of the working end, that is the last few millimeters, which is adjacent to the toe or the tip of the instrument, must be in constant contact with the tooth while the instrument is moving. That is how it should be adapted. Okay, the last few millimeters of the instrument must be in constant contact with the tooth. Then angulation. Angulation means the angle between the face of the bladed instrument and the tooth surface. So angle between the face of the blade and the tooth is known as angulation. How is angulation important? Because for subgingival insertion of any bladed instrument, you should use angulation close to 0 degree. Otherwise, it is going to injure the gingiva. So that is why angulation plays an important role. Similarly, during scaling and root playing, the optimal angulation is between 45 to 90 degrees. If you use an angulation less than 45 or more than 90 degree, the efficacy of your scaling is going to reduce. So you have to use an angle of 45 to 90 degrees. Next is lateral pressure. Lateral pressure means it is a pressure created when you apply a force against the tooth surface. This lateral pressure may be firm, moderate, and light. Similarly, there are 3 types of strokes that we can give by which we can obtain a lateral pressure. Yes, these are exploratory stroke, scaling stroke, and root planing stroke. The exploratory stroke, from the term it is very clear, it is just exploring. So it is a light feeling stroke. It is done with the probes and the explorers. This is to evaluate the dimensions of the pocket, or which instrument is used for that? Probe is used for that, right? And explorers are used to detect calculus and caries and other irregularities on the tooth surface. After exploratory stroke, we have scaling stroke. Scaling strokes are controlled, overlapping, short, powerful pull strokes. They should be controlled so that we are not injuring any soft tissue structures. Overlapping, short and powerful pull strokes, and the movement should primarily come from the wrist arm motion. And root planing strokes are longer and lighter strokes, while scaling strokes were shorter and powerful. Root planing strokes are longer and lighter. So we apply less lateral pressure so that root surface is smooth and we are not unduly removing any cementum. So there are 3 types of strokes we said, right? Similarly, there are directions of strokes. Strokes may be in vertical, oblique or horizontal direction. Out of these 3, the most commonly used directions are vertical and oblique. If an area is not instrumentable with the vertical and oblique strokes, then you can try the horizontal stroke. We learned about that wide range of instruments used for hand scaling, root planing. On that, we have better alternative like ultrasonic scaling and sonic scaling. So important questions from this area are: ultrasonic scaling uses a frequency of 18,000 to 50,000. There are 2 types of ultrasonic scaling units, magnetostrictive and piezoelectric. In magnetostrictive units, what you should remember is the pattern of vibration is elliptical. Look at that figure. There is an elliptical figure with MS written in between. Okay, you should keep this in mind. And the movement is elliptical and all the sides of the tip are active when this is working on the tooth. But piezoelectric vibration is linear. Look at that arrow mark. So it is just moving back and forth. This means only the 2 sides of the tip will be most active. For magnetostrictive, it is elliptical, so all around that area it is active. Here it is back and forth and only the 2 ends are active. Magnetostrictive is elliptical, piezoelectric is back and forth or linear. Then sonic. Sonic tip ranges from 2500 to 7000 cycles per second. Now sonic and piezoelectric ultrasonic do not generate heat. Heat production is usually seen in ultrasonic units. But sonic and piezoelectric units use a coolant. Why this coolant is used? To flush off the dislodged calculus and debris, this coolant is used. And flow rate of the coolant is, this is an important question, 14 to 23 milliliters per minute. Mind, 14 to 23 milliliters per minute. Now I want to familiarize 2 terms for you. One is instrumentation zone and one is channels of instrumentation. The scaling and the root planing strokes should be confined to the portion of the tooth where calculus or altered cementum is found. This area is known as the instrumentation zone, the zone which actually requires our instrumentation, where calculus and altered cementum is present. This area is known as instrumentation zone. And while we instrument, the overlapping areas where we use the instrument is known as channels of instrumentation. Overlapping of the pathways using our instrument, hand or ultrasonic or sonic instrument, this is called the channels of instrumentation. After we finish instrumentation, how we check for smoothness? Smoothness is the criterion by which scaling and root planing is evaluated. But ultimately, how do we know whether our scaling and root planing was effective? It is based on the tissue response. And finally, this is the last slide. I have seen questions on sharpening also. There are natural and synthetically produced sharpening stones. Examples of natural abrasive stones are Indiana and Arkansas oil stones. And synthetically produced sharpening stones are carborundum, ruby and ceramic stones. Then we have already discussed which grasp we use in sharpening of instruments. We use the palm and the thumb grasp. And there is a particular angulation for sharpening of instruments. It is 100 to 110 degrees. Most of these things you already know. There are some new additions like the periodontal maintenance, Gracie curates. So that's all. See you at the next class. Thank you. Any doubt, please contact me.